to now adjourn. And I call the honourable member for...
No, it's on the screen.
Member for Cooper, by virtual presence.
Thank you, Deputy Speaker. Thank you very much. I'm speaking from my electorate on the land of the Wurundjeri people of the Kulin Nations, and I pay my deepest respects. Deputy Speaker, I want to bring to this House's attention the seriousness of the issue of allergies and anaphylaxis. Anyone who has seen a child have a sudden and severe allergic reaction to food will know the horror and fear it can bring. My son would flare up if I simply kissed him after I'd eaten peanut butter, so severe was his allergy. My brother nearly died from an asthma attack after visiting a house that had been freshly painted with paint fumes thick in the air. And I myself suffer with giant urticaria, better known as hives, but giant urticaria sounds much more dramatic. It's not as severe, but if I do have an attack, I feel very unwell, I find it painful, and it looks horrendous, being covered in large red welts, and it certainly keeps me from home, from work, it keeps me from work and unproductive. Like so many who, as a result of allergies, require healthcare, medications, and time away from work and life's activities. More and more, we're beginning to understand complex allergic disease. Sometimes multiple allergies are experienced at once. For example, a child with a peanut allergy will often also have eczema, allergic rhinitis or hay fever, and asthma. And poorly controlled asthma in a patient with food allergy is a risk factor for life-threatening and fatal allergic reactions. There's been a significant increase in the complexity and severity of a range of allergic diseases over the last couple of decades. Allergic diseases are amongst the fastest growing chronic diseases and public health issues in Australia, and it currently affects more than 4 million Australians. The Australian Society of Clinical Immunology and Allergy and Allergy and Anaphylaxis Australia led a team of experts and those who lived with experience in developing a national allergy strategy. They describe an alarming state of affairs with what is an urgent and serious chronic disease problem for Australia. They've reported that over the last 2 decades, almost 20% of the Australian population has a confirmed allergic disease, and this prevalence is increasing. Hospital admissions for anaphylaxis have increased 5-fold. Recent studies show that 10% of infants have an immediate food allergy. 5% of adults may be allergic to 1 or more drugs. And drug allergy-induced anaphylaxis deaths have increased by an alarming 300%, and drug allergy-induced anaphylactic presentations have trebled. Deputy Speaker, there are often misunderstandings about allergy and a temptation to label many medically unexplained illnesses as being due to an allergy, indicating a lack of education about the condition. Up to 15% of people believe they have a drug allergy but don't, and therefore they are denied treatment with an indicated drug. This lack of public awareness about the impact and appropriate management of medically confirmed allergic diseases can result in the use of potentially unsafe alternative tests and therapies. Patients are often referred to a succession of different medical specialists, resulting in confusion and poor treatment. It's been reported that chronic allergies like eczema or atopic dermatitis can result in depression and even suicide amongst sufferers. GPs, pharmacists, dietitians and allied health professionals, nurses and specialists are all important in the need to tackle this problem, and they, along with consumers, are calling for a nationally coordinated approach. The rapid and continuing increase in the prevalence and impact of allergic diseases on the health system and the quality of life of patients and carers and the economic costs demand this. I thank Dr. Preeti Joshi and Ms. Maria Sayed, co-chairs of the National Allergy Strategy, and their colleagues, Associate Professor Kirsten Perrott and Dr. Jennifer Copland from the Murdoch Children's Research Institute, Jill Smith and Sandra Vale from the Australasian Society of Clinical Immunology and Allergy, for meeting with me a couple of times now to discuss the need for a national approach. I also thank the many people in my community who contact me, families and individuals who suffer terribly with chronic allergies, many who are constantly in fear of anaphylaxis. In 2019, the Federal Parliament held an inquiry into this issue, and in 2020, the Health Minister accepted all the recommendations from the inquiry. In particular, his government announced support for establishing a National Centre for Allergies and Anaphylaxis, clinical research into food allergy treatments, and establishing a national register of anaphylactic episodes. I urge the federal government to take the necessary steps to start the implementation of a national allergy strategy for Australia. Thank you.
I call the honourable member for Bennelong.